Tomorrow, there's a hearing here in Washington in the Congress concerning mental health. It's a hearing tomorrow. The examining H.R. 2646, the Helping Families in Mental Health Crisis Act, which is being put forth by our next guest. Representative Tim Murphy represents the 18th Congressional District in Pennsylvania and joins us here on POTUS. He tweets at Rep. Tim Murphy and is here. Welcome. Thank you. Welcome back.
Good morning. Good to be with you.
So
Thank you.
Let's talk about this particular piece of legislation. And obviously, we've seen a lot of evidence lately about issues with people having problems with mental health. What is this law supposed to do?
Well, the law really reforms our mental health system in America. It is not one that's designed to really help those with severe mental illness. We have a lot of feel-good programs out there. We have many programs which exist but are very disjointed. And so looking back on a couple of reports we received from the General Accounting Office, this nonpartisan part of the government that evaluates programs, they told us that there are some 112 different federal programs that are disjointed, disconnected, and quite frankly dysfunctional. That even when we have good pockets of treatment programs out there, they're not working. So this bill creates the Office of the Assistant Secretary of Mental Health and Substance Abuse. Doesn't need new money for that. We do it out of existing programs. It also reforms a number of the barriers that keep you from getting help, and then revamps the grant program, which right now has not been working, doesn't use real science in it. One of the things I want to mention, of course, in the news is this issue about James Boulware from Dallas, Texas. It's being reported he had mental illness. He had sought help before. He had acts of violence before, threats, pretty clear evidence out there that severe mental illness. And yet, by the current system, because you have to be in a state of imminent threat to kill yourself or someone else, people won't make you get treatment. One of the parts of our bill is to incentivize states to do something more in what's called assisted outpatient treatment for this very kind of person. The person who has a history of violence and arrests and schizophrenia and doesn't take their medication, doesn't get involved with treatment. We want to avoid situations like this. But unfortunately, we can't the way the system currently works. Not all people with mental illness are violent. It's a tiny minority, but that's the minority that we think that when we're dealing with severe mental illness, we want to help those.
Is it about the medications not taken? Is it about medications also? Is it about how these individuals are treated? What's the takeaway from that?
Well, part of it is the medication. With those with mental illness, we know they can be helped if we get them the help. Medications, psychosocial parts that also deal with such things as making sure they get psychotherapy, there are job training programs, treatment, etc. But when you're not in those treatment mode, the chances of decrease. In fact, a person who is in treatment versus not in treatment, the person who's in treatment, who's severely mentally ill, is 15 times less likely to engage in acts of violence than someone who is not in treatment. What we want to do is make sure in these cases that states and individuals have the option to help make sure that instead of us arguing about whether or not we should be taking someone's rights away by compelling them to get into treatment, we have to understand that when you are in jail or when you're homeless or when you're in a coffin, you really don't have any rights anymore. And those who are victims of these kind of crimes, we want to make sure that we are helping to save their lives as well.
Once again, Representative Tim Murphy is with us. He represents the 18th District in Pennsylvania and is one of the authors of mental health legislation. Specifically, the bill we're talking about is H.R. 2646, the Helping Families in Mental Health Crisis Act. What people might not know, and unless they heard our previous conversations, is that you spent time as a clinical psychologist. And I wonder, given that and what you can bring to bear on this legislation, the idea, what frustrates you when you're trying to treat people, what frustrates any psychologist or psychiatrist who's trying to treat people when it comes to either government regulation or expectations, I guess?
Well, I've been practicing almost 40 years as a psychologist and currently practice in the Navy as a Navy psychologist. And so I have frontline knowledge of these things. And what is so frustrating is that when you see someone who has the brain illness of mental illness, that it's difficult to get them help. I'll give you an example. If you saw someone who was wandering the streets of the city in a winter day, who's maybe 80 years old, barefoot, talking about having to go to school the next day, you're pretty clear that this person may have dementia or Alzheimer's, and you'd get them help. Or the same with someone with a head injury or stroke victim. We would get them help. But when it comes to mental illness, it goes down this strange road of saying, well, it's not illegal to be crazy. And so we're not going to force them into anything. Now, I look upon that it's not illegal to have a heart attack either, but for goodness sakes, we don't tell someone, just go ahead and go on your merry way. If you have a heart attack, well, let us know if you're going to die. We have to treat mental illness as a brain illness and understand it's there. And so our research work, our work towards getting care, our focus in hospitals, community services, supports, needs to turn and start to address it in that way, that it's a brain illness. It's not an attitude. It's not a choice. It's not a way of life. When you're hearing voices that are commanding you to do things, when you're delusions and paranoid, when you're so severely depressed that you can't even talk to someone in any reasoned way about whether life is worth living, we see these as times that we need to step in and do things psychologically, medically to help someone and stop ignoring them.
What's the timeline now? You have the hearing tomorrow, and then you move forward with a full committee vote at some point? Take us through that.
Well, we're hoping there's a full committee vote in another month or so. We'd love to get this through because this is needed. This is necessary in America, and time is lives with regard to this. So the hearing tomorrow, among our witnesses, we'll have Senator Creed Deeds. You're probably familiar with this case. He was the one who's tragically, his son attempted to kill the state senator from Virginia, former gubernatorial candidate, and then his son Gus killed himself. We'll also have Jeffrey Lieberman, the former head of the American Psychiatric Association and chair of the Department of Psychiatry at Columbia. Some top-line people there, including Congressman Patrick Kennedy, to talk about why we need this legislation. Let's move it now. Let's stop putting lives at risk. Let's stop the treatment before the tragedy.
All right. Congressman Tim Murphy, thank you for joining us this morning.
All right, thank you very much.
Representative Tim Murphy represents the 18th District in Pennsylvania again, talking about the hearing that will take place tomorrow. We will follow that closely. H.R. 2646, the Helping Families in Mental Health Crisis Act. Congressman Murphy tweets at Rep. Tim Murphy.